Hey, good afternoon, everyone, and thank you to everybody on our Zoom chat here today and anyone else that may be entering late. I am Jordan. I am the membership director of the Greater Chambersburg Chamber of Commerce. And, this is no secret. Everyone knows that this has been a heck of a year, the year of COVID-19. The year of uncertainty. COVID-19 literally seems to come up in probably almost every conversation that you have or hear during the day. If you log on to social media, Facebook, Twitter, Snapchat, Instagram, you're going to see something about COVID. So COVID. So what I wanted to do for our amazing membership is bring in my friend, one heck of a good guy from Keystone Health. He's the chief operating officer there, Dave Grant, to come in today and give us an update on COVID-19, and in particular, an update on how we are looking here in Franklin County, given Keystone Health is a backbone of our community. So just want to make a quick note that this is not a political debate. It's not the time or place. I simply asked Dave if he could come in and provide us an updated information based upon the information that he's receiving every day. So Dave, thank you so much. Folks, if you have a question that you're dying to ask Dave, please just send them directly to me in the chat. And then at the end, we're going to open things up for Q&A if time allows. So Dave, my friend, the floor is yours. Thank you so much.
Great. Thanks very much, Jordan. And thanks everyone on the meeting here for joining us this afternoon. Just to give you some background, at Keystone Health, we do a very large amount of testing in our community. Our Chief Medical Officer, Dr. Mike Cawley, as well as our infectious disease specialist, Dr. Raghav Tirupathy, have really led a lot of our efforts. And so some of the information, the tail end of this, I will provide from you that's provided to us on a routine basis from Dr. Cawley. What I'd like to do, I put an agenda up there. Hopefully you can see it. What I'm going to do is sort of start very globally, if you will. I'm going to look at our U.S. data. And I think some of the questions that along the line is, where are the officials getting data, or what are they relying on to help make some of the decisions related to whether we open or whether the schools can go back full time in person, or whether we have to do other mitigating efforts. And, we get a lot on the news and a lot of our various channels, but I'm going to try and take a few moments today just to get down to some specifics of where that information comes from so that you can see it with your own two eyes. I'm not sure that many of us have gone out to these particular channels to determine some of this data. So we're going to look at IHIME. We're going to look at a quick national data review and the state data review that's from IHIME. Then I want to demonstrate or show you where on the DOH website we rely for some of our information, and trying to coordinate that with, why haven't our schools opened at least in person, or have chosen not to open in person at this point. Whether or not we would agree with that, I just want you to understand how some of those decisions are being made. And then we're going to get down a little closer to Franklin County and what is happening here so far. And just I want to preface it by saying, I think so, in the last few weeks, the news has been nothing but good. And so, and then lastly, what our Keystone experience has been. And then I'm just going to share a location for a toolkit for business related to reopening during COVID. Many of you business owners have already done so, and done so safely. I'm just going to provide another resource just in case there's something you might want to review specific to your business. So without further ado, I'm going to go ahead and switch screens here. We're going to jump right into the IHIME data, which gives us an idea again of what we are doing across the nation. So what you should see on there is IHIME. The IHIME stands for the Health Institute for Health Metrics and Evaluation, and they have the COVID-19 projections on here. So what we look at, and what we've looked at from the beginning, and as this has evolved, their data analysis has gotten better and better and better, because obviously back in March, they were operating under certain assumptions. And as we learn more about it, those assumptions became better and tighter. So we feel pretty confident in how their projections are running. So as you hear, when you hear on the airwaves that the United States has had total deaths so far, this is where that information is coming from. And this is projected, by the way. Okay, so right now, by December 1st, there's a projection of about 310,000 deaths. And so where are we today? You look at this curve, this shows us that we are at about 166,000 deaths so far related to COVID. And then as we progress out, what they do is they look and they say, okay, here's the current projection. What happens if we start to ease some of our mitigation efforts? Let's get rid of social distancing. Let's decide that we don't need to wear masks or otherwise. And I recognize that's a hot topic, and I'm not here to really get into the politics of it. I'm just trying to show the data behind this, and then masks and easing, and then of course the projection. So if you go out further, you can see that as we ease or decide to ease, the projections start to diverge a bit, and that's where that 300,000 projection comes from. So right out to the end of December 1st, you can see that 307 number in the middle is the current projection. If we ease up on certain mandates, the projection is we could hit close to 415,000 deaths. And if we do a universal masking protocols, we could decrease that from 310-ish down to 241. So when you hear that just by wearing masks, we could cut our death rate substantially. This is where that data is coming from, and it's built on history of what we know about of how this disease has progressed. And so that is one instance of the current death rate. These are the daily deaths. I don't have to get into every single chart here, but again, everything's built on projection, easing, and masking. And you can see, obviously, if we ease up, they anticipate that the death rate will climb pretty substantially and pretty quickly. So what we see is death as a trailing indicator, if you will, of case counts. So that's why we're so concerned when we start to see case counts rise, because what we've seen in the past, back in March, April, May, is that when your case counts started to rise, there's approximately a 2 to 3 week lag period between hospital utilization increasing and then subsequently death rate increasing. So that's why the concern whenever we see how many cases we have. So let's scroll down here a little bit to daily infections and testing. This is an important metric to look at, and we'll get into this a little bit deeper when we look at Franklin County. But the death rate, as well as the daily infection and testing rate, or what we call the positivity rate. The good news is positivity rate is dropping, and so even though we're doing more testing, we're finding less cases per testing. And I think that's an important point, because that sometimes gets distorted. When you think of, well, let's just stop testing and then we'll see less cases. I think the reality is we're testing more now than we ever were. And I can speak certainly for Keystone in that regard. And we're seeing less, which is exactly what you want to happen, which is part of the good news. This is important from the standpoint of the hospital resource use. Again, this is a lagging indicator, the leading indicator being case counts rise, hospital utilization starts to go up a couple weeks later, a couple weeks after that, you see your death rate start to rise. So right now, what we're seeing here is that as of now, hospital utilization, the projection on this, again, if you look down at the bottom, the blue line is invasive ventilators needed. That's when obviously when patients are extremely sick. ICU beds needed. So again, extremely sick, but perhaps not on a ventilator. And then overall, all beds needed in the current projection. So what we're seeing now, and this again, keep in mind, this is across the United States. We haven't got to Pennsylvania yet. You're seeing that the invasive ventilator needed current projection is fairly flat. throughout the remainder of the year. Starts to jump up a little bit in November and December, and I think that's where we don't really know what the fall is going to look like. One of our big concerns today in healthcare is what's the fall going to look like, because we know that we're going to be grappling with influenza symptoms as well as COVID-19 symptoms, and then how do we obviously are going to have to test to ensure that is this influenza A, B, or is it COVID-19? And so that's why I believe that they're projecting an uptick in hospital bed utilization as we get into the fall. Mask usage. All right, so again, this is where we are today. If we have easing or universal masking, what you're seeing here is this projection is the goal. And right now we're approximately right here where universal masks, about 53% of our society is masking on a regular basis. And if you recall, when we look back to how important that is, that's where this chart comes into play, where you look at your case counts or your death rate and masking, and that's where the idea that if we do mask, we will indeed decrease deaths overall. Social distancing. Just to know, there's this sort of a chart of how well we're social distancing, and there are various ways they measure that. Some of them are a little creepier than others, where they can use cell phone data and otherwise to track how what movements look like and so on. But by and large, I think a lot of this is really built on some surveys. So any questions on the U.S. data so far? My hope is this is probably the first time that many of you have seen these charts. I know, Teresa, you tuned into a previous presentation, so you had seen them. But I also think it's very important that we understand where some of this information is coming from that's impacting our lives and livelihoods.
Dave, this is great information. I don't currently see any questions in the chat, so I don't see anybody with anything currently.
Okay. Thanks, Jordan. Let's look now. Let's get down a little more granular level and look at Pennsylvania and where we are. So currently, Pennsylvania is projected to have approximately 15,000 deaths by December 1st. If we look at our current trajectory, we are rising a bit in Pennsylvania. Universal masking, again, we could cut our deaths by approximately it's about 8,000. And so one of the reasons that we believe masking is very important, our current projection is tracking with the easing. So you can see those two lines are almost identical. But the good news is it looks like they anticipate we will still be masking, and this can change. The important part about this is these projections change routinely. This is a snapshot in time. So as we mask better, or as we continue easing efforts, and I'm not talking about shutdowns necessarily. I'm just talking about doing what we're doing. Let's maintain social distancing and masking. We could have a significant impact on this disease. Daily death rate. Again, here's our projection. Masking and mask mandates easing. So if we ease all of our mandates, you can see the difference in the projected death rate. And again, keep in mind, snapshot in time. Daily infections and testing, and I'll get into some more numbers. And for those of you who let me apologize for the non-accountants. This is it's a whole lot of numbers on these pages today, but that's the nature of what we do in trying to analyze what's going on. Okay, so daily infection and testing. I'll get into this a little bit deeper as we look at Franklin County. And then hospital resource use in Pennsylvania. So far, I think we're well on track. Certainly in Franklin County, we've been doing great as far as hospital resource use. Mask use. Percentage of the population who say they always wear a mask in public. That's what this is a measure of. So these are surveys. and then social distancing. And here's where I said some of this is measured by cell phone mobility data. So those are our Pennsylvania numbers. Anything related to PA before we get into some of the Franklin County and actually the Department of Health information? Take a pause. No? Okay. All right, so let's look at, what do we look at from the Pennsylvania Department of Health? And where does this data come from? So every laboratory in Pennsylvania, once they receive lab results, they send them to the state. At Keystone, we do some point of care testing here that doesn't go through a commercial lab. So it's a lab test that we do on site. Well, everyone that participates in that lab process, we report those results through a program called PA NEDS, NEDSS. So that's how the state is very rapidly able to capture all this data on a day-to-day basis, because it's a quick turnaround process. All the labs, including all the point of care facilities, are submitting data to PA NEDS on a daily basis. So this information is really up to date. We rely on a couple different spots. One, let me see here. So here's your Pennsylvania data tab. And this is on the PADOH website, coronavirus website, Pennsylvania data. And there's a couple dashboards we look at. This one's particularly busy. But this is Pennsylvania cases. If you look at the tabs here at the bottom, I'll let that load. I'm not sure it's quite loaded yet. And if at any point you're not seeing what I'm seeing, please let me know. But you should be seeing a black dashboard, Pennsylvania COVID-19 dashboard. And you can see on the left where you have confirmed, probable, negative, and then deaths. Or is that what you're seeing right now?
It is, yes.
Okay, terrific. Okay, good. Good. Make sure we didn't get zoomed. All right. So what we're seeing here is just, again, this is updated. These charts will show us new cases per day and deaths by day across the entire state of Pennsylvania, back from the beginning of this event through yesterday, and then the deaths by day as well, confirmed cases, and of course, obviously, very it's very telling information. You can get down to the county data, zip code data. Some of that similar stuff that's on IHIME, a lot of these databases talk to each other, so I don't want to be duplicative and walk through all of the different aspects, but you'll see cases and death demographics here. So if you're interested in seeing where, what age ranges we're seeing, the cases by race, cases by ethnicity, and cases by gender. If we look at the death demographics, you can see that the deaths have occurred primarily, not all, of course, but there's obviously they're weighted very heavily toward the 60 and older. And then male and female, similar split, but interesting enough, more female than male deaths in this disease.
Dave, just wanted to ask you, this data that we're looking at here right now, right. I mean, this isn't stuff that only you can see. This is
publicly available.
Public, correct?
Yep. I am on the Pennsylvania Department of Health website, coronavirus tab. And so this is all publicly available.
Wonderful. Thank you.
Yep. Of course. Good question. All right. And so then we get into this early warning dashboard. And this sort of tells us, this is one that we like to monitor on a routine basis because it kind of looks at what's potentially happening, what's coming. We've got the longitudinal data we've known since March, but now what's happening? And the way we look at this is we look at it generally over a 7-day rolling period or a 14-day rolling period. We've kind of compressed this a little bit to a 7-day period. And so what you're seeing here then is this is the Pennsylvania confirmed cases, all right? And this is, again, a trailing 7 days. So this, no, let me rephrase that. What you're seeing here is the difference between the week prior and last week. So if you look, this is the difference between the most recent 7-day period and the previous 7-day period. So we're looking at things week over week. And so in a 1 week period, we've had a decrease of 1,142 cases across the state, pretty substantial. The incidence per 100,000. Now, this is again across the state. We'll talk about where we are in Franklin County. This is a metric that's population adjusted. So you take the total case count divided by the total population. Based on a per 100,000 population, and that's where you get this metric. So it's population adjusted. So, you could say Franklin County with 150,000 has 50 cases, for example. That's much different than Fulton County with 50 cases, if that makes sense. Okay, so then we look at the percent positivity. This has become an extremely important metric because this tells us out of all the testing we're doing, how many patients are testing positive. I can tell you that at one point at Keystone alone, this was about 40%. So that tells you that you have a very high degree of community spread. Right now, across the state, we're at 3.4% positivity rate. So we're testing much more, we're finding less cases, which I think is a positive. Average daily hospitalizations week over week are down 70. And the average daily ventilators week over week are down 12.4. Hospital visits due to COVID are actually up slightly at 0.7 week over week. Okay. Any questions about this data so far?
Well, Dave, we did have our first question come in. Whether or not you want to answer this now or tell me, or if you want, I can come back to it at a later time. But first one is, at what point does one need to get tested? So how much contact to a person that has been exposed would happen to determine I would need to be tested? Or is it a wait and see if I get symptoms and quarantine until then? And then also, where do I go in Franklin County to get tested?
Okay, great. So the way we look at this is we consider a significant exposure. This is right out of the CDC guidelines. So significant exposure is being within 6 feet. That can all be debated, but this has played out pretty well, that it seems within 6 feet for greater than 15 minutes. 6 feet, greater than 15 minutes. All right. And then and that's to somebody who's a known positive. So where can you get tested? I know WellSpan does some testing. Here at Keystone, we do testing. We do a couple different kinds. We do asymptomatic testing. So if you have no symptoms and you're sort of worried, and you need your employer, or you as an employer, of course, are requiring employees to get a negative test before they return to work, or you're worried and you just want to know, boy, I was in contact, or I think I might have been in contact with somebody. We do that currently at 830 Fifth Avenue. It's actually one of our buildings. We do asymptomatic testing there. If you're symptomatic, we direct you to our urgent care at 111 Chambers Hill. And the reason we do that is we try and obviously keep separate symptomatic and asymptomatic where we can. It was a bit of a volume issue, frankly. We were getting so overwhelmed at one location that we had to sort of separate them. So a lot of demand for testing out there right now, especially. And while we're on the topic, I just want to address the idea of the rapid test versus the commercial laboratory tests. There's we've got a lot of demand, obviously, for the rapid test, which turns around in approximately 15 minutes. And I know that we've had, several instances where patients and consumers would come to the facility upset that we would not give them that test. Or provide that testing, and there's some logic behind that. So what we did is, working with the company and our infectious disease specialists, that test, if you go back through or do a little research, you'll find that it has approximately a 30% false false negative rate. And so what we said is, and what we were advised is, if you have symptoms, you're likely shedding more virus. And the way that test works, it amplifies the RNA. And so, not to be too scientific, but it does an amplification process. And if you are symptomatic, you'll have more viral load, most likely, and then the amplification process will work best, and you'll get a better test result. So we have chosen that we're not going to use that on asymptomatic patients. And some folks I know will come in and feign a symptom just to get that test. You're really not doing yourself a good justice if you do that. It's truly best if you're symptomatic. We can get good test results. Commercial labs, I know this is a long-winded answer to that question, I'm sorry, but commercial labs, we were having significant lag time on especially one of the commercial labs, sometimes up to 10 days to 2 weeks, in which case testing is useless, because now, that's the quarantine period. So you might as well just stay home for 2 weeks and see if you develop symptoms. But what we find now is that both commercial labs have really stepped up their processes, and we're getting turnaround from a commercial lab in approximately 24, 48 hours. So much better testing than we had just last month.
I mean, that was essentially why folks weren't getting tested, was because they were fearful. I think that incubation period, they would already find out it doesn't necessarily matter. So
right.
Yeah.
In fact, sometimes testing didn't even change the recommendation. Folks would come in, get a negative test, and still be told to quarantine. They're like, what's that all about? And you can understand that, but there's also logic behind that as well, because some of the testing wasn't as specific, as sensitive, as specific as we needed it to be.
Great, thanks, Dave.
So, of course, did I answer the question?
I know who asked, and I think you did a pretty good job answering it.
Okay. All right. Thank you.
Yeah.
All right. So now let's drill a little bit more into Franklin County. So we look at Pennsylvania as a 3.4% positivity rate. And if you go across here, these are those differences that we see over the week over week period. So if we can just drill down just to Franklin. All right. So Franklin County, week over week here. So here's actually everything in a chart. Hopefully you can see that little chart that popped up, that table, I guess, that popped up. So confirmed cases week over week. We are most recent 7 days, we had 39 cases. In the previous 7 days to that, we had 78. So we've seen a reduction in cases week over week. Incident rate per 100,000. This is that population adjusted metric. We had 50.4 cases, and we're down to 25.2 week over week. Positivity rate. This is again very good news. Previous 7 days, 5.3%. Most recent 7 days, 2.9%. So our positivity rate's dropping pretty substantially, and we hope that continues. Average daily hospitalization. Yeah, Teresa, I'm clapping about that one too. Average daily hospitalization, previous 7 days, 3, most recent 3.3. And that, if you recall, that kind of tracks with the rest of the state. With a slight uptick in hospitalizations, hopefully that's not a harbinger of things to come. Patients on ventilators, that's again a good news, indicating maybe less severity of disease, where we were at 1.3 and we're now down to 0. And then emergency department visits, previous 7 days, 0.4, most recent 0.6. So again, that might track with some of the hospital admissions. Any questions related to that? Okay, and again, publicly available. You can go onto the website, PADOH, and all of this is easily available to you. This here just gives us the if it'll load, it's pulling mounds of data. That's why it takes a considerable amount to load. This is really a quick look at newly reported cases. This shows the trending week over week of everything. So as a state, once again, it shows that everything is trending down, and that's good for all of us. Except looks like hospital emergency department visits stayed level week over week. Okay, let me just check out my agenda here and make sure we have it. So we covered the early warning dashboard. Again, this positivity rate for me is a particularly great story. Let's hope that continues, because that's what you want to see. You want to see more testing, but lower rates of positives. So that's what we're hoping for. Okay, and then let's just talk about, again, Franklin County and our region. And then this, we'll look at this, just a different visual, if you will. So I'm gonna switch screens here. This is another publicly available data set, but it's not, you need to be a little bit of a numbers person like me probably to access it. It's a huge data file that you're able to pull into various analytics tools. I happen to be using Microsoft Power BI here. You could do various things with Excel, but it's available on GitHub. So to attribute it, since the pandemic started, Microsoft has been updating a data set on a repository called GitHub, and they've been doing that every single day. They do have a little bit of a lag, approximately 24-hour lag, because they want to validate everything before they post it. I can live with that. And so what I do then is every day I hit a button, bring all this data in just to see where we're at. And so what you're seeing here is the entire state of PA, every county. The circle is indicative of the number of cases in that county. So the larger the circle, the more cases we've seen. And then, of course, red, yellow, and green based on the sizes. So it's all sort of a relativity index of the entire state of PA by county, by case count, and population adjusted as well. So I wanted to make that point, because just looking at raw case count really doesn't tell us the whole story. So what we did here is it's this bottom left. This is just Franklin County cases per day. And this is over the time frame of the last 2 weeks, inclusive of August 25th and August 12th. And so you can see back on August 12th, we had 10 cases, 8 cases on the 13th, 14 cases, and so on. And so what I've done is I look at this at a 2-week snapshot, because what we're interested in is certainly the initial opening plan that the DOH put together. One of the metrics they used was they wanted us to have no more than 50, that's 50, cases per capita, 50 cases per 100,000 population over a 2-week time frame. So that's what you're looking at here, a 2-week time frame, how many cases. And so right now, Franklin County's sitting at 72 cases over that 2-week time frame, 72 cases per capita, with a goal of 50, right? But again, we're trending in the right direction. This was closer to 150, 160 back in March and April. So, and we actually at one point were down to 30. So we climbed up a little bit after the holidays. I think, we understandably, in some cases, relaxed some of our family gatherings and larger gatherings, and a little bit of COVID burnout, or what we call quarantine fatigue, set in. And so we did see some spikes. And we haven't quite yet recovered from all that. We've still been sitting right a little bit over 50 for the last few weeks. This is the region. So if you look at the South Central region, this is the DOH broke the state into regions, and our region includes, I think, 6 counties. And so this is what we're seeing for the region itself. And if you go 50 per capita in those counties, so it must be 7 counties, 650 would be the threshold. They're at approximately 900, but perhaps trending down. And then lastly, I like to look at this in the context of the entire state of PA, and that's why the bubble chart here. So what you're seeing is the last 2 weeks, Fulton County is at 47 cases per capita. If you see that little pop-up, Franklin County, again, as we know, is at 72. You get out around the Philadelphia area, they're at 102. And in these smaller counties, up in northwest PA, here's McCain County at 2.3 cases per capita. Warren County at 7.1. I think this might be Center County. Yeah, so this is of interest to me because I have a son at State College. They're at 35 per capita, and hopefully it stays that way. Any guess on why this big red blob in Union County at 215 cases per capita? Anybody have a guess on that one?
Bucknell University?
No, good guess, Sam. It's not a university. It's the prisons. So Union County has, I think it's Lewisburg, if I'm not mistaken. They have a federal penitentiary, state pen, and it's been they've had a lot of positives within the prison system there, and that's what's attributed to this. Whoop. Taking on a mind of its own here. So, sure is. So this is so that's some of the state data itself. Regional, I think once we get down to the regional level, it's interesting. What we do at Keystone, and I haven't shared this, and for obvious reasons I won't, but we do have address level data of our positivity rate. So we are able to find out where, if anywhere, we might have particular hotspots, if you will, and try and address those. And we've done that throughout the pandemic here. I can at least speak for Keystone in that regard. Just to give you an idea, I'll give you some Keystone specific information and maybe take some questions if you'd like. So again, data provided here by Dr. Cawley. This is updated as of August 25th. The overall positivity rate at Keystone since we started, we've tested about over 4,000 patients, and 689 of those have returned positive. That gives us a 14.6% positivity rate overall since the pandemic. What's of good news is that most recently, this is Keystone's positivity rate. Now you'll remember the county itself is about 3.4 because there's more testing centers than just Keystone in Franklin County. But even at that, Keystone is about, we're almost at 5% positivity. And if you recall, back approximately 2.5, 3 months ago, we were at nearly 35% positivity. And so, again, good news. Our rolling positive, Keystone positive rolling 14-day average has gone down substantially. We're about five per day on a rolling 14-day, and that's positive case count. And that's it. So one thing I did want to point out is that you'll hear like, when do the schools open, or when can schools go back in person? And I think the metric they're using for that is a 1 week look back, and they want to have less than 10 cases per capita in the previous 7 days. So let's just update this chart for that. Ignore this 50 for a minute. Pretend this is 10, because our goal for here would be 10. So if we go back, starting from the 25th, and we go back 7 days, we are now at 37. Okay, so where in-person education is promoted and allowed again, we should be at 10. That's the recommendation from the state. We're now at 37. So I hope I gave you a decent overview of where some of the decision makers are getting their data from, what some of the stuff we look at, and the stuff I've sort of, for lack of a better word, have been fixated on over the last few months, trying to understand what's our next move and where do we go from here. And I'll take a minute to see if there's any questions related to this before I direct you to the business toolkit.
Dave, we have a few questions.
Okay,
First one, I believe I know the answer to this, but I'll let you go ahead and answer. Will we ever get
sure.
zip code data, or will county data be the lowest we will ever get to?
I think you're likely, well, we can do zip code. I think, and the state's only going to report probably down to the county level. I don't think they report zip code data. I haven't seen that out of the state, so I
Okay,
couldn't speak for them. Yep.
sounds good. Um, another gal, just saying, great information. Maybe this is a silly question, but hey, there are no silly questions, right?
Right.
With asymptomatic carriers, how might someone know to go get tested?
So you don't, and I think the CDC guidelines have changed somewhat abruptly in the past week. I think there's some controversy surrounding that. But if you're asymptomatic, the best thing I can offer you is if you know that you have been within 6 feet of a person who's tested positive for greater than 15 minutes, I think that might be a good indicator that you might want to go get tested. If you know you have a known positive person who you've been in contact with under those circumstances, that's where we'd recommend you get tested.
Thanks, Dave. And then last question I have on here from the folks that are participating here today. How do you anticipate the normal flu season impacting all of this?
Please get your flu shots. I know that again, it's we have some idea of what it might look like. So as an example, one of the things we're wrestling with, let's just take our pediatrics practice, and you could extrapolate this as well. One of the symptoms are similar. There are a lot of similarities. And luckily, what we've seen in the past few months is when COVID hit and we put those mitigating efforts in place, flu all but vanished. So it was gone. And we're anticipating that, given that the students are not necessarily face to face for all of the negative aspects of that, we anticipate that if that continues, flu season's probably going to be fairly light. It would only stand to reason that if we're not congregating and spreading flu around, it would probably be pretty light. So we're anticipating, I guess, two different things. One, if we start to open back up again, which I think we're all hoping for at some point, what's that going to look like? The short answer is we don't exactly know, but we know that we're going to have to treat everyone with those symptoms as if they're under investigation for COVID. So I thought what we're hoping for is commercial labs will come out with not only a COVID-19 test, but a combined flu A, flu B, RSV, which is another particular virus we deal with, and COVID all in one package, if you will. And so if we can do that, that would make testing a bit simpler and help us to guide that greater. But 90% of the walk-in visits that we see in the wintertime will likely have symptoms equivalent with COVID, whether or not they have it.
Thanks, Dave. I had a personal question. I don't know if now's the time or you can answer it later, but kind of curious. I mean, there's so many different types of masks that are out there that we have to choose from. I mean, is there a certain mask that you're recommending over another type of mask that's out there?
I wouldn't speculate on masking. I think if we often say, a cotton mask, something that's cotton, that's going to not only I can tell you what we don't recommend. So, we see those masks with that one-way valve. Okay. So that really doesn't meet the intent of why we want a mask, because you're still able to expel, if you're positive, expel virus. So those are the ones we wouldn't recommend. One of the important things about masking, and I had there was one of the infectious disease professors from Hopkins did a podcast. If you're interested, there's an excellent podcast called Public Health on Call. It's updated routinely. I think they do it daily. And they talked about masking and why it's important. And the reality is, even those who get COVID, depending on the amount of viral, what's called the viral inoculum that you get, you can get extremely sick if you get a high viral inoculum. So you have somebody who's shedding a lot of virus who gives it to you. Conversely, what they're finding is those who end up with a lower viral inoculum. So say you're in contact with somebody, but you're both masked and somehow you do end up contracting the disease. Because you were masked and because you have less viral load, in general, what we're seeing is the symptoms are much, you may even end up asymptomatic or your symptoms are much less.
Wow.
So again, cotton masks, don't recommend the ones with the one-way valve. I understand it's probably easier. Some respects they're easier to breathe, but they really don't do what they're supposed to do.
And then sort of the last personal question I had was, I mean, there's like a talk of, immunity, I guess, and I don't know if this has been proven or not, but, let's say somebody gets the coronavirus and, they go through the 2-week period and then they're not feeling, the symptoms anymore. Can that person still give, the coronavirus to somebody, or does that person have a chance to, get sick again?
Right. So I don't know if you've heard most recently, there was one of the first cases of reinfection.
Okay.
And so there's still a lot of debate about reinfection with COVID-19 and how long immunity lasts. And so I think the answer to that isn't known just yet.
Okay.
Mm-hmm.
Anybody else have any questions? If so, I mean, please, you can unmute yourself if you'd like, or if it's easier, just shoot something over via chat.
Join the Thursday.
I'm not seeing anything.
Great. Well, I hope that's because I covered everything and not because everybody fell asleep.
No, you did a great job.
Great. Let me just share one thing with you because of the audience here. I think it's probably good to note, if I can locate it here. There is here it is here, operational toolkit for businesses considering reopening or expanding. So those of you who've reopened and maybe not have expanded, on your screen you should see Johns Hopkins Center for Health Security.
I actually don't think we're not seeing that.
All right, let me switch up here.
Yep.
There we go. You think after all this time I would be proficient with Zoom?
Look,
okay.
Give yourself the benefit of the doubt, buddy. You're doing a great job.
Okay, so here you're seeing the Center for Health Security. So there is an operational toolkit for businesses considering reopening or expanding operations in COVID-19. And I walked through this once or twice. It has the instruction manual, fairly simple to follow, a risk worksheet, kind of detailing you plug in the particular activities that your business does. It tells you at what risk level your business is for spreading COVID-19 and how to assess that. But more importantly, it gives you some mitigation efforts. And I see a lot of the businesses locally have done great jobs. I see plexiglass up. I see certainly the mask requirements, and believe me, I understand that can be very hard to enforce and otherwise. But this really gives you an idea of what are the possible mitigation steps that I, as a business owner, can put in place to do my part to try and decrease the spread of COVID-19. And I think the quicker we can all do that, the quicker we can all get back to business. So where that's located, I mean, I can send this to you under a separate cover if you want to forward it to everyone.
I'd be happy. Yeah.
Okay, great. And here I can also, I guess, maybe put it in the chat.
Perfect.
Yeah, if I can find it here. Oh, there it is. Okay. There you go.
Yeah,
so it'll be in there as well. But again, just a nice tool to give you some perspective and get your thought processes as to what could we possibly do. And it's very possible many of the businesses have already done everything on that list, but it's a good checkup.
Well,
Great.
Dave, we can't thank you enough. Seriously.
No, yes, thank you. I appreciate you asking for this. It's refreshing, and hopefully there's a little more understanding of where some of these numbers are coming from, other than what we hear through our normal channels.
Yeah, I just thought it'd be beneficial. I mean, there's so much information going on, like just out there for the general public. So it's kind of hard to know sometimes where you should be pulling your information from. So really thank you for coming in here and kind of clarifying all that. And I second what Ginny said here in the chat. Just want to say thanks to everyone at Keystone that's on our front line during this pandemic, man. Seriously, we really, really appreciate you guys for what you do.
I will pass that along to the team.
Yep.
I appreciate it.
Yep.
We appreciate the business community.
Yep. Well, Dave, don't want to keep you, man. I know you're a very busy gentleman. So thank you. And obviously hope to, see you again here sooner rather than later.
Sounds good. Thanks, everyone. Thanks, Jordan. I appreciate it.
Yep. You take care. See everybody.
All right. See y'all soon.
Yep.
Bye-bye.
Bye-bye.